And thank you for joining us tonight. I'm Monique Minglavin from the Cairo 7 studios.
And hi, Monique. Hi again, everyone. Steve Rabel here. Social distancing and reporting live from home. I want to get you the very latest numbers here at 6 o'clock. Take a look from the State Health Department. There are more than 12,400 cases now. 692 people have died. That's 10 more since just yesterday. Taking a look at Snohomish County for some perspective, of the more than 2,200 cases there, more than 1,500 patients have recovered.
And now we know the first known person to die in the U.S. from coronavirus was not in Washington after all. Health officials in California identified 2 people who died early in February. Cairo 7's Graham Johnson talked to experts about what that means.
Identifying these early cases in California is a big deal. Experts say it indicates there was at least some level of community transmission in America in January. Until now, we thought the first people to die of coronavirus in the United States were patients at Life Care of Kirkland. A 55-year-old man and an 86-year-old woman were both transferred out of the center and died February 26th. But now we have confirmation of coronavirus deaths on February 6th and 17th in Santa Clara County, California.
They're really like iceberg tips.
Santa Clara Health Officer Dr. Sarah Cody says medical examiners kept samples and recently got enough supplies to test for COVID.
What these deaths tell us is that we had community transmission, probably to a significant degree, far earlier than we had known.
Because if you think about it, somebody who died on February 6th, they probably contracted that virus early to mid-January.
The director of the Harvard Global Health Institute says this rewrites our understanding of the virus's early days in America.
Things we put into place in late January, like the travel ban, the virus was already here by then and probably circulating quite widely.
What's interesting about these new cases is that they don't have a reported travel history.
Dr. Louise Monclub, a virologist at Fred Hutch in Seattle, tells me it will be important to figure out if the early California cases were part of a large or small transmission chain.
What's a little puzzling about this finding is that if there was widespread transmission in California for 20 days before we knew it in Washington, we would have expected there to be an outbreak, a large number of cases of people going to the hospital and dying in California before we saw our outbreak in Washington.
The head of the University of Washington's Department of Epidemiology, Dr. Stephen Haas, tells me antibody tests will be important for understanding the scope of early infections.
It won't tell you the timing of that when the initial infection happened, but it'll at least tell you if a person had been exposed and infected to the coronavirus.
King County health officials tell me at the start of this outbreak, the medical examiner's office here was not retrospectively testing people who had died because there was such limited testing. And the office also did not preserve samples, but they are now testing for bodies that are still in the office. Graham Johnson, Cairo 7 News.